this morning is our very last day of the trip, and I think we have a full day of dentals, which is usually about 18. We're running 4 stations on this trip, so all the 4 stations are getting all set up. All the horse trailers are lined up the hill, as you can see, so we're just getting our stuff ready, setting up. So the horses come in, and then we evaluate their teeth, get a little bit of a history, do a physical exam.
As soon as we have the first castration in, we are waiting for them at the castration station.
So we're all on intercoms, their radios, and they tell us what's happening. We were given a bunch of water to use up. A lot of these properties don't have running water, so we just make sure to bring our own that we need for our equipment. So we'll do all of that. So in dentistry, what our goal is to address the horse's health through its teeth. It used to be that horses died when they were 18 with old mouths, because we didn't have dental care, and now we have the ability to extend their lives through excellent nutrition and excellent dentistry. So I routinely see horses living well and into their 20s, and actually being athletically active well into their 20s. So it's just really amazing that in the 20 years I've been doing vet medicine, we've extended horses' lives so dramatically, and I think those are the 2 factors. Okay, one last thing. I mean, I know that I've done so much good for the horses that it's a wonderful feeling. Like, are we exhausted? Yes. Do we desperately want a really long hot shower? Yes. But you just feel like you did something this week, something really important. And you know how there are weeks in your life that like stand out in your memory? Like you think of just random weeks in your life that just go by like that, and you can't even remember what you had for lunch, what you had for breakfast, what you even did. It's just gone in your life. These weeks stand out in your memory as if they were a month long, right? Because so much happens. You cram so much living, so many amazing people all working together to make sure that no one gets hurt and we do what's best for the horse. Some days are better than others, but we keep on showing up together and getting it done. So I suspect you're going to be able to appreciate on the video like how amazing that is. I mean, I'd say like mostly it's really, really positive. Yes, it's exhausting. There's been a few hard hits to the solar plexus this week, when our people get hurt. You know, that's a hit. Like the people that got hurt were very experienced horsemen who can read a situation and set themselves up for success. And still, horses get too fast and too reactive sometimes for us to keep ourselves safe. And it's a humbling reminder that you just have to remember you're never faster than a horse, ever. And they are kind to us and like us, and it behooves us to earn that. I've certainly seen some situations out here where I've seen people handling horses in ways that I wouldn't suggest. You're escalating their behavior, you're pushing them up into a situation versus bringing them down, meeting them on their level, asking permission instead of just walking up and just slamming into them, because we think we have the right and we have no right. They are 1,000 pounds and 10 times faster and stronger than us, and they are letting us do anything. They are giving us permission. That is all there is to it. And so it's good to have a reminder of that every once in a while, because sometimes in my regular day, I get exposed to only kind horses that have been so consistently trained that they never say boo. They're never going to react to anything. And then you come out here and these animals are just a little bit more closer to to feral, just a little bit more close. Some of them were feral, say yesterday. and it just reminds you that horses trust us so much in our daily. So even that is a breath of
I've charged Connor and Mark as runners
amazing. Thank
because
you.
we've got no Annie and no John.
Right.
So that those two can kind of be whatever
And you saw
anybody needs them to be.
we got 4 students at intake. At the end of the
great.
day, when it quiets down, they'll probably start showing
They
up.
can shift around.
I got 1 student assigned to hoof trims doing all the sedation, so you don't even
Perfect.
have
So
to
they-
worry about
right.
her. She's solo, and I've given you 3 students to either
Yep.
use in surgery or send them as runners or
Right.
floaters,
So
whatever
we're
you
going to
need.
use them there, I think, and told them that they're not going to get as much
They're cool.
cooperation as they've.
I'll take them to dinner
But no,
tonight.
you know what? They are cool. They're great, and I'm gonna try to let them do as much as I can.
Oh, sure.
But I may have to grab and pull myself some.
Honestly, they graduate in a month. I've been turning them loose. They're really good horse handlers.
They are.
So-
They've been great. Great. So I do want to let them do as much as I can, but we've got 17 castrations.
Just use them as the good hands.
Exactly.
That you see.
No, and
them.
they are.
Yeah.
They're great.
Yeah.
So they're doing great.
Cool. Yell if you need anything, but I think I'm stuck
I will.
in dental land.
Same here.
We're just running solo over here. We won't need students.
Well, just holler if you need me.
Thank you. I mean, Neil is our new fearless leader because Mark got taken out by a spicy young potato yesterday, and so he's at the chapter house resting. But I think he's gonna do just fine.
A little tired,
A little worn, but
ready to go.
Yeah.
Yeah, I'm excited. Last day, this whole week has been really fulfilling.
oh, it's been awesome.
Yeah, we've done a lot of horses, and it makes me feel good to know that they're gonna go out there and eat better.
Yeah, I've gotten to do a lot of things that I haven't gotten to do yet before and seen, and with the guidance of the veterinarians here, I feel very confident in the skills I've developed just here, and then the horses we've helped, and been able to give the owners a lot of really good advice, making their horses more comfortable for both eating and performance-wise. So I feel this was a really good trip. I feel very fulfilled in what we've done, and I'm excited for the last day.
Yes.
And seeing what we find.
We've had so much fun this week hanging out with everyone, gaining knowledge.
Cadence and I actually went to 2 different dental schools. We're both IAED certified, but we got our education at different schools, and we met on this trip, and it's been really cool seeing each other's work and the different methods that we use and the knowledge that we can share, and we're bouncing back and forth ideas with each other, and it's been really cool
Yeah,
getting
it
to meet
has.
another dentist out here. So
Yep.
my dog.
What was it like teaching the students?
They already had the knowledge and the skill, so it was fairly easy on our part. Teaching has made me learn more and has helped me, and they see things that I don't and vice versa, and so we've been helping each other, and it's been really awesome.
For me, it's been really great kind of challenging them. So it's really difficult to get a week's worth of practice in mouths, and they're not getting a full week. A lot of these students are getting like 2 days in dentistry, and they're not going to leave here doing our degree of work or the vet's degree of work, but they have all this extra knowledge that we're giving them along with their foundation, and then what we're giving them is a lot of solid foundation skill with the instruments. We're getting them a lot more comfortable with the instruments, and I really like how thorough they are. Like they're taking their time. They're not taking off too much, which I would rather have them taking off less than taking off too much, of course. But it's been really great being able to show them different techniques on how to better handle the instrument with different horses, and seeing their improvement through each horse that they do. And then once I feel like they're doing really good at it, I'm like, get in there, do the whole thing, challenge yourself. You don't get to do this much, so you got to really put forth a lot of effort to get what you can out of such a short trip. So they've been fantastic. They've been really willing to listen to us. They've been parrots on our shoulders, seeing what we're doing, and it's been really cool being able to share what we've specialized in and spent so long training to do, and being able to share that with them and kind of open up their eyes to just how complicated this actually is, And I think quite a few of them are going to want to keep like working with dentists in their future so that they can keep improving their own skills in their own practice. So I think that's really cool that they want to keep learning about it. They want to keep pushing themselves to do better and better with each horse, which is really cool.
And learning to get comfortable with the horses, getting comfortable sitting down there and being right in their mouth. And working with the veterinarians this week, I think it's really awesome that they work with us dentists and that we have gained knowledge from them also. And they have helped us on this trip to gain experience, knowledge, and helping the students has been awesome.
I think one thing I really like that this trip, because a lot of these horses, they're not as intensely handled as, you know, the riding horses we have back home, is so they've gotten to see that some of these horses, they just don't sedate very well. And so so sedation isn't always the answer because it's not always going to help you. So you have to take it upon yourself to alter your approach, how you handle the instrument, how you handle the horse, to try to help them understand what you're doing and work with the horse. You can't overpower these animals. They're magnificent beasts. So you have to change how you approach yourself and the horse and try to figure out how you work with them, but also seeing a point where we had a difficult horse the other day, and I'm like, it's very easy at this point to want to quit. Be like, that's good enough, but it's not. So you can't give up. A horse is going to suffer if you lose your vigor. So you got to keep working with the animal so you can get that mouth where it needs to be. Because not enough is not preventative. Too much is reckless. You've got to do a thorough dental for that dental to last a horse for an entire year and to come back, and it's just touch-ups at that point. It's not excessive sharpness again. If thorough dental, you'll find it where it's barely minimum anything to do a year from later. So I think it's been really cool seeing that they've gotten to see just how much we have to adjust how we work per individual animal. So
You have to, each mouth fits each animal. You have to change your approach for each animal to fit
different
them.
game plan. You always develop that before. You don't just go in and start hacking away at sharp points and high points. You need to look at the whole mouth. You see the occlusion before and after, because that's going to clue you in on what you can do, how much you can do, where you want to be more reservative, so you don't lose that occlusion at the end of the dental. It can be really easy to look in the mouth and see all the things that are wrong and just want to go start hacking away at it, but you have to pause. You have to think through anything you touch in the mouth. It has to have a reason. You need a reason to touch a part in a horse's mouth. So develop a game plan, do it, and you're going to be really happy with how that mouth closes down and how it performs over the next year.
Preach, sister. Preach.
It's been cool. The students have been great. That's Dr. Fisher.
Yeah.
So.
Yeah. I think that concludes our...
For more. Hello, front desk. We have 4 excited dentists ready to do anything at all. Anything.
I want a pony.
Send us a horse.
Get me going.
Something with teeth.
Yes.
Something with teeth.
Fun teeth.
Well, do you know how few sinus cysts I've got to diagnose that have been 5 years in? Like, normally they're actually a diagnostic challenge. Normally I need a standing CT.
Because it's so small.
Because it's so small.
Yeah.
And there's an intermittent booger that I got to go chase down. And now I'm like, oh my gosh, like, this is a drive-by diagnosis. Look at this spectacular X-ray.
Oh, man.
Right? And so yeah, it's just so much fun.
I haven't worked with all the students yet, but of the ones I have gotten to work with,
I haven't gotten to work with any of the U of A, so I'm really sad. Danny boy.
Danny boy. Hi. You still having fun?